Here's a Q&A. My mother had breast cancer. Does bioidentical hormone therapy increase my risk even though they call it natural? So number one, bioidentical is the term that's referenced and used for a type of estradiol, progesterone, and testosterone, for instance, that is also called body identical, but it is chemically exact to what your ovaries were making in structure. Not an analog, not slightly off with an oxygen-hydrogen bond. It is sourced and derived from soy and yam. So even when you get your 17-beta estradiol patches, your estrogen patches, or your estradiol pills, for instance, they should be 17-beta estradiol. They're sourced from the same source, quote unquote, naturally, soy or yam, and some compounding pharmacies can make them too. That's what bioidentical hormone replacement therapy is. So because it's natural doesn't mean it's not a prescription, that it doesn't require monitoring, and that it can't have side effects. So that part's imperative to start with. In terms of risk stratification, the mother having breast cancer, what we need to take into account in someone like this, the family history, mutations, BRCA, BRCA2, other genetic mutations, the age at which she was diagnosed, 75, 80, 40, 42, how many family members, ER positive, ER negative, the patient had prophylactic mastectomy, prophylactic oophorectomy, is the patient herself really young, intimacy-wise, brain fog, functioning, all these factors that she was pushed into potentially for surgical menopause, for prophylaxis, for instance, and now she's risk stratifying. So there's a lot that will go into it. Personally, if you have had a history of breast cancer, I will not prescribe you estradiol, progesterone. But if we need to look into more depth options for symptoms that you're having, vaginal symptoms, intimacy symptoms, etc., we can start pulling out options from the integrative perspective. There are plenty of herbal remedies that do have nice clinical studies behind them that do help. Sometimes I'll also do laser therapy. We will think outside the box and we will find a solution and answer to minimize what you need depending on your risk profile. MRI surveillance, I make sure that that's something that we've looked at for patients too. I review your records thoroughly and spend quite a bit of time with you. So just it being bioidentical doesn't necessarily make it therefore safe or quote unquote natural with this risk factor. I would definitely caution you to make sure you go to a person who really understands and spends the time to look into history and understands the physiology and is willing to collaborate with your oncologist as well.